Well, I'm Brittani Dingess. I am a pediatrician at King's Daughters Primary Care in Pediatrics, Bellefonte. So I became interested in pediatrics during my third year of medical school. I actually went into medicine thinking I would probably do anything but pediatrics, but as I got into my family medicine rotation, I realized I liked interacting with the children and doing the well child visits and things like that better than I did, with the adults. And so I just sort of went into pediatrics, started doing a lot of rotations, a lot of my elective rotations and things like that in pediatrics, and just fell in love with it and went from there. So I did my undergraduate work at Marshall University in Huntington, West Virginia. I then went to the West Virginia School of Osteopathic Medicine in Lewisburg, West Virginia. I graduated from there in 2013. I then went and did my pediatric residency at CAMC Women and Children's in Charleston, West Virginia. And then when I graduated from there in 2016, I started my job here. We provide services for babies starting in infancy. I do newborn rounds, and so I start from birth and see children, adolescents, all the way up through even the early college years. So I have a few patients now that are in their first, second year of college that I still will continue to see until that time. We do well child visits, we do sports physicals, of course, and then I like to do things with behavior development, any sort of delays or anything that the child has, making sure that we're getting them into early intervention services, things like that. We also do sick visits. We just added walk-in hours to our clinic, so Monday through Friday, 8 to 4. Children can walk in without an appointment to be seen for an acute illness. So if they're feeling sick, need to be swabbed, something like that, we can take care of that as well. We do testing for developmental behavioral disorders, ADHD, things like that as well. I think that the thing that I enjoy most about pediatrics is the continuity. When you start out seeing babies from infancy, you see them so often and so frequently, you really build really good relationships with both the babies, the patients, and their families. And you get to follow them as they grow. That's absolutely my favorite part about pediatrics. I'm originally from South Point, Ohio, so just across the river. I actually went to South Point High School, graduated from there, so local to to this area for sure. I wanted to come back to the area where I grew up, and so all of my family, my parents, everybody are very close by, and so when I was graduating from residency, I definitely wanted to find something back in this area. So that's always something that I wanted to do, even when I started out early on in my career in residency. The plan was always to come back here. So yeah, it's good to be home.